companies of the Indian Pharmaceutical Alliance, that's the powerful grouping of India's 20 leading drug companies, are mulling a proposal to discontinue selling similar medicine brands at multiple price points. If the decision is finalized, the drug companies will sell only one brand for each molecule. The move comes in the backdrop of recent statements of Prime Minister Modi, who indicated a new legislation to make it mandatory for doctors to write prescriptions in generic names in a bid to lower prices of drugs. Vikas joins us now with the latest. So Vikas, yesterday we had the IMA president telling us that in consultation with the Indian Pharma Alliance, their recommendation was that this business of multiple prices for the same molecule and multiple brands for the same molecule, that practice should end. What are you picking up? Is the IPA now willing to move towards that?
In India, many companies sell different brands of the same compound through separate divisions, and that may also come at separate price points. Now, this has been a major topic of discussion over the last few weeks, ever since Prime Minister Narendra Modi hinted that there will be a new legislation to bring down prices and also directing on doctors to prescribe generic medicines. Now, after this, the industry has gone into several discussions on how do we control prices of drugs and how to remove the disparity between different brands. From our discussions, we understand that the Indian Pharmaceutical Alliance has actually asked some of its member companies that this is not something that may be acceptable, even after getting feedback from the government that this is creating some confusion in the minds of stakeholders, that there is an element of high margins in different products. So what we understand is that the companies have discussed, and there may be a possibility that they may start selling one product under of one molecule, and there will be just one brand, which will mean that, say for example, there is a company which sells a cefixime and a ofloxacin antibiotic under two different names through two different marketing divisions. If this comes through, it will mean that there will be only one brand for this particular product, and there will be one price point. So this will remove the confusion that companies are actually making profits through selling the same kind of a product under different brand names. This particular possibility was discussed recently by the Indian Medical Association, and Dr. K.K. Agarwal, the president of Indian Medical Association, had also made a similar reference to this particular possibility and about his discussion with the Indian Pharmaceutical Alliance. So we are expecting this to happen sometime soon.